that's pretty much all I have to tell you about the Prince William Committee of 100, but if you have any questions, find me, ask me. I'll be happy to share more information. I have the distinct privilege of introducing this guy. Does he look like anybody at one of the tables? You know, we all have our headshots that we circulate out there. I've got one of those too. And you look at them, you're like, I don't think that's that person, but actually, you do actually resemble this picture. This is Bruce Potter. Bruce Potter is the publisher of Inside Nova. He is also the COO of Rappahannock Media. I memorized that. Many of you already know him. I will read. He has been a publisher of Inside Nova and the weekly Inside Nova Prince William newspaper since it was founded in 2013. He previously was publisher of the Potomac News and Manassas Journal Messenger, later combined into the News and Messenger. He has worked as a reporter, editor, corporate executive, and publisher in Virginia journalism since graduating from Washington and Lee University. Fancy. As publisher, Bruce oversees all editorial and business operations of Inside Nova, including marketing and sales. He also serves as Chief Operating Officer of Inside Nova's parent company, Rappahannock Media. Let's welcome Bruce Media, our moderator, to the podium.
Thank you. Sure. Thank you, Belle, and that picture is scary. That's way too big. Glad to be here and to have the opportunity to moderate the panel discussion this evening. And before I introduce the speakers and have them come here and join me, I want to take advantage of the opportunity just to do a quick commercial, if I might, if you'll bear with me and allow me that privilege, because this group is a group of people who is obviously very interested in what happens here in Prince William County. And one of the things that is happening in Prince William County, and we are not unique, is that local media has never been more challenged. And we face a huge challenge in the local media business, whether we're Inside Nova, whether we're the Prince William Times, whether we're Potomac Local, whether we're Bristow Beat, any of those other news organizations that are out there. To be perfectly frank about it, advertising revenue no longer pays all of our bills. And we Google and Facebook and Amazon and the big tech companies have come into our communities and taken billions of dollars of advertising revenue, and they don't give anything back to those communities. They don't come out and cover your local school board meeting or your football games or your board of supervisors meetings. So we have to rely more and more on local folks like yourself to support us, whether it's through subscribing to the newspaper, donating online, supporting our advertisers, whatever you do, whatever you can do is critically important. And I just want to share that message, and it's not something that we talk about a whole lot. We've also found it's not something that people are aware of until the local newspaper disappears. And there are thousands there were just 2 local newspapers in Virginia last week that shut down in Southside Virginia. Those are the only newspapers in those communities. We're lucky to have a couple here in Prince William, but they need your support. So I don't care whether you support us or you support the Times or Potomac Local or something, but supporting local media is critically important. So thank you for that diversion. And I'd like to introduce. Go ahead and get the panelists to come up here, and then I'll introduce them. We have Kathy Schuster from HUGS, Phyllis Jennings Holt from the Department Director of Social Services, and Dr. Tahida Yazim from the Prince William County's Office of Community Safety. For those who are not aware, we were supposed to have Major Kevin, I think is it Hubert?
Yeah.
From the Prince William County Police Department. He had a family emergency late this afternoon and so could not make it. So we obviously regret that he couldn't be here, but certainly understand. So pray for seat. So I'm going to start by introducing each panelist and just have them do a kind of a brief presentation or make some comments on the topic of panhandling. And as Belle said at the outset, really, that's a very narrowly focused topic that obviously has lots and lots of facets to it. So it's there's a lot of different issues around that, but it's been an issue in our community over the last year or so. Due to complaints about panhandling and actions by the Board of Supervisors or proposed actions by the Board of Supervisors. So this is an opportunity to kind of do a deeper dive into the issue, and then we'll take it from there. And well, ask each of, I'll start with Ms. Schuster down there on the end. Just ask each of our panelists to do, give us an overview of the issue from your perspective. And then when we've gone through all three, I have some questions and we'll open it up to the floor for a Q&A. So I'll introduce Kathy Schuster first. Kathy is the outreach coordinator for HUGS, which is Help Us Grow Strong. That is a nonprofit all-volunteer organization. And in her role, she communicates with individuals and groups interested in learning or assisting unsheltered folks here in the Woodbridge area. She also manages weekly meals provided by volunteers and the distribution of donations, seasonal clothing, hygiene supplies, and non-perishable food items. She is a federal government retiree, and she and her husband Ed joined HUGS in 2015. So Ms. Schuster, I'm going to pass the microphone down to you and let you take it from there.
Good evening, everybody. This is my first time here. Can you hear me?
Yes.
First thing I want to tell you is HUGS is a 501c3 all-volunteer organization. We don't pay anybody. Everybody's out there because they have the desire to try and help the unsheltered in the area. I do want to point out one of my right-hand people there, Ken Davidson. He has been with HUGS almost as long as I have, and he's out there every week. He hauls our tables, our pop-up tents, the whole works. I carry McDonald's gift cards in my car. I do not give money. If they are not interested in that gift card, they only want cash, I move on. When we first started with HUGS almost 10 years ago, a majority of the panhandlers out there were unsheltered. Within the last couple of years, especially since COVID, a lot of scammers have come out. The guys in the yellow vests claim they're collecting for the homeless. They're not. They were researched. They're collecting for a mega church in Florida. I don't like the aggression. Somebody doesn't want to donate. There are some out there that do pound on windows. The ones that run around the cars scare me. We've had several unsheltered get hit and taken to the hospital and treated. Bear with me, I'm going through my notes. We also have the ones out there with the funeral signs. They're out there every month, same funeral. The fake injuries or disabilities. A lot of us have seen those. Walking with a cane. As soon as they're done panhandling, that cane is swinging. And they are bebopping it down the street. Or the other ones who are sitting there rubbing their legs and, just, I'm in so much pain. And then as soon as they're done, bebopping down the street again. The addictions and the drug dealings, that's also going on these corners. I guarantee it, I know some of them. Within the last 6 months, we've had several unsheltered known to us, pass from overdoses. They're panhandling. getting money. I've heard people say, well, you can't tell me what I do with my money. I also had a couple say, well, let nature take its course. I'm sorry. It doesn't work that way. These people are human. The violence that goes on out there sometimes because somebody's on a corner that they don't think they should be on. There was an incident a couple months ago. Somebody was out there just selling flowers. She was actually selling something, you know, just asking for donation. I can deal with those. Don't want it, but I can deal with them. Two of the unsheltered jumped her. Police were called, split them up, that was the end of it. Stolen valor. I haven't seen a lot of that recently. I'm retired Army. My husband's a Vietnam vet. Ken's retired Air Force. I know Al's retired. Nothing irritates me more than the stolen valor. Like I said, we haven't seen a lot of that in the last few years. People want to do good. I've talked to several people who have taken what we call blessing bags out to the people. They have a bottle of water, a pair of socks, some cheese crackers, peanut butter crackers. Every so often they'll stick money in there. They see the money, they take the money, that bag goes to the trash. People will bring them clothing. A lot of times it's still sitting there on the median. Get food gift cards. They don't want it, move on. Something that was mentioned to me the other day, that comments have been made, well, let's just put them on a bus and get them out of the area. One, you're not going to find them all. You can't find them during the pit count, which happens once, twice a year. They know you're coming. They're not there. And while we're talking about that, just recently in the Washington Post, I saw an article that DC is looking at emptying out all the encampments. Want DC to put them on a bus stops? That's not logic. That's cruel, is what that is. And it's going to get a lot worse. We saw it after COVID. We also, when we first started, we were just helping unsheltered. After COVID, we have families coming to us because they go to ACTS, they go to the other food pantries, but when you're talking families, 5, 6 people, that's not enough food. So we're doing that. With all the firings and the layoffs that are happening right now, it's going to get worse. There are programs out there that can help. My experience is a lot of them don't even answer the phones. I can't tell you how many times I passed on a phone number or phone numbers and have been told, we know that number, they never answered the telephone. We just had a big eviction in the area we support. And there were 3, 4, 5 camps that were affected, all because of one camp that came in that had been evicted from over the Big Lots area, came over by us. They caused trouble at Sheets, drug dealing, fights, there were stabbings, there were shootings, prostitution. So they evicted everybody. A couple people came out from the county. We're here to help. They didn't help. Said, we're gonna help you get housed. Well, where's the paperwork? Well, I don't have it. Why don't you have the paperwork? This is your job. 3 times this one person came out. Never brought the paperwork. Police saw it also. And were just as disgusted as I was when I heard about it. Say, why can't they get a job? Hard to get a job when you don't have an address. Very few places in the county that will hire if you don't have an address. Or if if you can't take a shower. Can't get housing if you don't have a job. Can't get a job if you don't have housing. This $13 for trash pickup that's out there. I laughed when I heard about it. These people on the corners within 15 minutes can make that. They're not gonna go out and pick up trash. I'm not going out and pick up trash. We've got to do better, but we've got to improve our programs to help them. We need affordable housing. Supposedly, the new apartment's going up where we set up affordable housing. In what person's mind is $1,800 for a one-bedroom apartment affordable? One of the families we help, there's 6 of them. 2-bedroom apartment, $2,500 a month. Barely scraping by, which is why she comes to us to get support. I don't like panhandling, it scares me. We can't do anything about it because it's by constitution they can do it. But we can try and make a difference, offer gift cards. If they don't want them, move on. Support some of the organizations that are out there. I'm not putting in a plug for Hugs, although more than happy if you want to become part of us. Love everybody jumps out. Anybody wants, I did bring flyers with me if anybody would like to find out more about us. You're more than welcome to have one. We have some great people that we support. We've had some that weren't so great, but we deal with them. They give us respect. Help the organizations that are actually doing something out there. There's a group in Manassas, just like Hugs, provide meals every Saturday or Sunday. Have another group here in Prince William, provide meals on Sundays and canned goods. Find out who those groups are. Help them, help those. And keep in mind, we are all just one paycheck, one drink, one pain pill, one death away from being homeless ourselves. I can attest to that. When I was growing up, almost, and when I was going through my divorce. Keep that in mind. These people are dealing with mental health issues, addiction, death of a loved one, be it a spouse, a child, a mother. Figure out how you can help them. Thank you.
Thank you, Kathy. That was very interesting and powerful. And we'll come back and lots of follow-up questions here. But let's go through the our other 2 speakers, and then we'll circle back. In the middle is Phyllis Jennings-Holt. Ms. Jennings-Holt has served in various roles for the Prince William Department of Social Services since 1992. She's been a social worker, a case manager, and assistant director of protective services. Then she served as deputy director until becoming acting director, and then finally lead director of the department last year. The Department of Social Services provides safety net services for children and adults in the county facing abuse, neglect, family instability, homelessness, financial insecurity, underemployment, and/or health crises with no insurance. Last year, the department served more than 200,000 residents. As the director, Ms. Jennings-Holt oversees a team of more than 420 employees in numerous programs, including homeless services. So I'll pass the microphone to you.
Good evening. First, I want to say that I agree with a lot that you presented here tonight, Kathy. Sure. And that it really truly is important for us as agencies and community partners to work together regarding panhandling. What I can tell you is that the panhandling issue from where I sit has grown tremendously, especially since COVID. Not that it wasn't out there, but when COVID hit and people lost their jobs. And as you talked about one paycheck away and life happening, the number of evictions, the number of increase in food insecurity, and folks becoming homeless definitely increased. The face of homelessness has changed dramatically. And what I mean by that is that, it was a time many years ago when you looked at homelessness, you thought perhaps it was someone, I don't think they use this term anymore, was on Skid Row, right? That's not it. Our face of homelessness now is people who look just like us sitting in this room. People who are working, paying their bills, paying their taxes, and life happened. Somebody got sick, they lost their job. Everybody doesn't have 6 months of savings to carry them through. And then the next thing you know, you have an eviction notice on your door. So in the midst of COVID, we as a community partners and agencies had a task force, and we looked at the number of evictions that rose tremendously and the number of families. And I will tell you is that the growing population of homelessness is our elderly, right? Because Prince William County is an expensive place to live. And so we are all not prepared to live in a retirement community that's $9,000 a month. And some folks are really struggling. And so our elderly is becoming the highest population in homelessness. But the conversation we're talking about here tonight is panhandling. And so what I will tell you is that panhandling, when you look and you see the folks on the corner, is a combination of people who are unsheltered, and it's a combination of people who are not. Some people have somewhere to live, but they panhandle to supplement their income. So as the Department of Social Services, we have the Homeless Services Division, and I will tell you that in the state of Virginia, there's 122 localities that have social services. Homeless Services is not a Department of Social Services division. We're the only department in the state of Virginia that has homeless services under it. It's a HUD program. But many years ago, there was agreement before I got here that homeless services would be under the Department of Social Services. So we went from 4 employees now to 40 plus, serving the unsheltered. And we have a street outreach team. At one point, we had one person that was covering the entire county. When we get the call that we see somebody on the median by Chick-fil-A by Dumfries, or we see somebody on the median by Prince William Parkway by Noodles, this person was responding in real time to go out, to talk to them, to assess their situation, to see what services they need, to talk with them if they needed to come into a shelter, or if we could get them back to family, that type of thing. Now we've been able to at least increase it to 3 people since July, and they are throughout the county, reaching out to individuals, trying to assess their situation to see exactly what they need. I can tell you that some people are not interested. They're not interested in our services, and we can't make them take our services. Some folks, there is a lot out there where there is trafficking, okay? Where there's human trafficking, labor trafficking, folks selling the flowers. As again I said, some people are supplementing their income. And some people are unsheltered where they want to make just enough money where they can get a hotel, get them some food. But our thing from social services is being able to move them from panhandling to helping them get to a stable situation where they will be safe and be able to take care of themselves. Kathy mentioned the employment program that was presented to the Board of County Supervisors. That program has not been approved. Okay, so it's not in action, it has not been approved. It's been presented to the board, but the board has a lot of questions about the program, so at this point, that program is not active. We do have a communications program, which is called Give Where It Counts, where we are encouraging folks, instead of giving money to the panhandlers, to give it to the community partners like ACTS, Streetlights, Northern Virginia Family Services, HUGS, CCOM, so that they can help the individuals who are panhandling. And so, we've created a hotline where you can call if you see someone on the street panhandling, because the way that we have it set up, if Mr. Citizen said he is on Prince William Parkway and he sees a panhandler, he can call 792-3939. That number goes straight to one of our outreach workers. They will call back, get that information, and they will respond in real time to go out and talk to the panhandler, the individuals, so that we can help them. When Kathy talked about, there are some folks that are out there who seem to be fragile, maybe on crutches. We've encountered those individuals, and we've offered to put them in a hotel, we've offered to take them to they don't want it. And so the problem for us is, we want to be able to bridge folks from being unsheltered to safety, and everyone is not willing to be a part of our service provision. We do calculate, we do take numbers, we collect data, and what I know from this point, as of this month, that on the west end of the county, in Gainesville, the number of panhandling is increasing. Down here in Neabsco and Woodbridge seems to be a high numbers in panhandling. Yeah, in panhandling. But we are continuously trying to help people bridge from one step to the next. What we know is that panhandling will probably be around for a while because it's a First Amendment right. And so what I know from getting information is that we're kind of stuck in the middle. We have a faction over here that says, leave them alone, they're not doing anything, they're fine. Then we have another part over here that says, it's a nuisance, you need to do something about it, what are you going to do? So where we are is, anybody who wants services, anybody who wants help, we are willing to bridge them to the next step. But because they are adults, then they have to be the ones to say, this is what I want to do. And believe me, we go back out there, and we go back out there, and we go back out there. Some people we encounter 3-4 times before they're willing to say, okay, I'm tired, I don't want to do this anymore. How can you help me? And some people it's just like, go away, I'm fine.
Thank you, Ms. Jennings. That was a great overview of the issue from the county's perspective. Our third panelist is Dr. Tahida Yassin. She is the acting director of Prince William County's Office of Community Safety. In that role, she focuses on systems improvement, resident engagement, and developing policies that enhance safety and well-being through evidence-based approaches. She works closely with county agencies and community members to identify needs and implement strategic initiatives that improve processes and outcomes. In addition to her role with the county, Dr. Yazin is an affiliate faculty member at the Schar School of Policy and Government at George Mason University, where she leads the Legal Systems and Policy Lab. Her research focuses on lawmaking and the development of evidence-based policymaking tools. Dr. Yazin.
Thank you so much for having me, and thank you both for the work that you do in the community, and just the contributions you're making to really, not solving, because we can't solve it today, but just contributing so that we have a better infrastructure to dealing with the issues that people are facing in our county. So our Office of Community Safety is a fairly new office. We've been since June of 2023 in operations, and really our goal is taking a systems approach to how we address the issues of improving life outcomes, not just for people facing panhandling, because it's multifaceted. It's more than just the panhandling, right? As both of the other panelists have described. And so our goal with the Office of Community Safety is really to act as liaisons and the bridge to many of the agencies that are responding to issues such as panhandling, to the issues that you all talked about related to lack of housing, some of the opioid and substance use that we're seeing. And so over the last year or so, our office has really been creating better coordination, better systems management around public safety, around access, and the improvement of life outcomes. So both of our panelists mentioned the PIT count. Are you guys familiar with that term or what it means? Yeah, so Phyllis could probably do a much better job, but PIT count stands for the point in time count. And it's done once a year. It's a HUD program, and our office has participated in the last 2 years. This past year, I was able to go out, and we usually go out overnight to do the count. So this past January, you know, it was single-digit degree weather, and we were out there and we were talking to folks. One gentleman that we found in the snow, I'll call him Steve. He came out and we were able to do a survey. The point of the surveys is, so you talked about the gift cards. They do receive a gift card for doing these surveys, but it helps the county, it helps the country to get a better sense of where we need to make investments. And one of the gentlemen I spoke to, Steve, when we talk about faces of homelessness, this was a mechanic, someone who had for years honed his craft. And then one day woke up and his legs were numb. He was unable to go to work. And for the last 2 years, he's been out in the woods. And one of the things that he wanted was just to figure out, well, how do I file for disability? And so for our office, one of our goals is to figure out who's had a touch point with Steve. Was it our office? Was it Homeless Services? Was it HUGS? How do we gather all that data so that we're able to take a case management approach? So it's not just my office or Phyllis's office or police or fire, but we have multi-agencies who have an eye on Steve, and we're able to coordinate in better ways. And so that's what we've been working on. It takes time. It's not a system like this doesn't happen overnight. I'm in the safe and secure quadrant. We've got over 2,600 employees across over 15 different agencies, and so this takes time. It doesn't happen overnight, but the county is making investments in getting us to a place where we can take that case management approach and a whole systems approach. So it's not just one agency that is responding to these issues. Thank you.
Thank you. I'll open up just a couple of follow-up questions, and then we'll throw it open to the folks here. But Ms. Jennings, I wonder, I was intrigued by the whole concept of the strike force, which was that the term, the outreach team?
Oh, street outreach.
Street outreach. Yeah, strike force is probably the wrong term there, but because that's not something that I had heard, I was aware of. So you're saying that if somebody calls into the number and says, I see somebody panhandling at Prince William Parkway and such, your folks will go out there regardless of what that person's allegedly panhandling for? Is that, and
That's correct.
And have they had, can you describe any successes that they've had in that process? I mean, some challenges of folks not wanting to seek help, but any successes?
Sure, there's been some successes. What I will tell you is that, we all travel around the county, and so there was a particular day that I was going down the road, and again, you're all familiar with the 234 where the Red Carpet Inn is, right across the street from Chick-fil-A. I mean, it's pouring down, raining. And I see my employees standing on the median in an umbrella, speaking to this, person, trying to understand what's happening, how did they get there, what is it that they need. And so there was, when you're talking about a success story, sometimes we get information from our Board of County Supervisors when they get a call. And so when they get a call, they will usually contact one of the agencies, and a lot of times it's social services, and so we sent someone out. It was a mother, and she had a child with her, and so there was a concern, a valid concern, that she was in the median with an infant, concern regarding safety, right? If her and the child were going to get hit, and what was happening. Were they homeless? Did they have somewhere? Did they have something to eat? That type of thing. So they went out the first time. She refused, didn't want it. Okay, so she said she wasn't homeless. She said she was okay. We assessed the situation. We left her alone. The call came back again. We went back out. I believe this time she was tired, right? And so sometimes you hit that, for lack of a better term, sweet spot where they're ready to get assistance. And at that point, she was ready to work with the social worker, told them everything that was going on. We were able to place them in a hotel. We was able to get the worker to help them with benefits. Also, too, sometimes we encounter individuals that are not from here. They traveled from another state somewhere else, and they're trying to get back home. Well, if you have somewhere that you can go and you have family that can support you, we will help you get there. Because we would rather for you to be with family who is saying you can come here and live with us than to be here outside on the street. But the child was safe. You know, we were able to hook her up with services, and the caseworker continued to work with them and still working with them today.
Keep the microphone. I hope, if everybody can hear me, hopefully. You also talked about the marketing program, Give Where It Counts. Have you all seen an increase in calls, donations, contributions? What sort of success have you seen from that?
I can't really speak to the donations because at this point we don't have a tracking system for that. What I can say that there is definitely an increase in calls, right? I think it is a streamlined way of getting in contact with us so that we're able to respond. And so our homeless services staff has a system where they enter data, and which we review on a monthly basis to be able to, number one, see how many people the outreach individuals made contact with, who they were able to engage. We get information on why they're panhandling. We get information on the type of income they have. We get information, and we track what type of referral services we make for them to get them connected to, whether it's mental health, whether it's VDC, whether it's Social Security, and follow up on that. So yes, I would say that we have seen an increase in the number of calls that have been coming directly to our outreach team.
Okay, great. And if you'll pass the microphone down to Ms. Schuster, you talked about some of the alleged trafficking, the megachurch from Florida. How can people differentiate that from somebody who just needs help?
That's a tough question to answer. That really is. You see the guys in the yellow vests? Move on. You see firemen? Drop in a couple of bucks. If you see the ones, and I hate to say it like this, but there are so many fake injuries out there and disabilities. And I take a look, and if they're going like this, I'm going to question it. Because there is services to help something like that. The hospital's right down the street.
Right.
So you just, if they look high or they look drunk, I'm not stopping. If I'm stopping at a stoplight, they say something, I offer the gift card. 99% of the time, they're not going to take my gift card. They want money so they can get their next fix. So you just got to look at them and make up your own mind. You know, we have some in the group that we support that do panhandle, but they're only out there a short time period just to get enough to pay for their phones, to maybe get a meal that doesn't come out of a can. We had one, his boots broke, and he was proud to be able to go get them himself, but he wasn't proud of the fact that he panhandled in order to get that money to go get the boots himself. So you just gotta look at him. Ken?
The way that you can identify with them is if you work with the homeless and they travel with you, they know who they are and they know where they come from. Like the ones that come out of Roanoke, Virginia, their van pulled up here and dropped off. They come out of Hampton Roads and they're brought up here. Normally they have a orange bucket, like a Home Depot bucket, but if you work with the homeless, they know exactly who they are.
The other homeless people know.
Oh, yeah.
Yeah.
Oh, definitely.
Absolutely.
But if you don't have that relationship, if you don't talk to the homeless people, you're never gonna get that.
Right.
So if you're not riding with them, you're not there.
So I heard sort of in a different context that in many cases, if somebody is panhandling and they legitimately need help, talking to them rather than giving them money can actually be more beneficial. Or talking to them rather than giving them a McDonald's card or a Starbucks cup of coffee.
The problem is talking to him on a median at a stoplight.
Right.
Now, I know you have people that come out, Smoketown Road, Prince William Parkway,
Yeah.
4 corners, 4 panhandlers. Do they go to each one, or do you have 4 people come out, which I know you don't have people to do that?
No, because at this point, we only have 3, and hopefully we can dispatch them to Central, Western, and Eastern. But, they're out every day, and the reality of it is that, I'm sorry, the reality of it is there might be a lapse in time between when we get the call and when we get out there, and sometimes they're gone. So hopefully we can get out there in time so that we can make that connection. But sometimes they've already left. But I think the thing is that when you say, do they want the gift card or they might not want the gift card, it really is about where they are emotionally and if they're ready. And that really depends on them. The other part that I forgot to mention is that Community Services, our mental health agency, is also a part of this process, right? And they work with our street outreach as well. And so they too will respond with the social worker to go out in real time, especially if there's a concern that there might be a mental health issue, if the person is in a mental health crisis, or if substance abuse might be an issue. When you talked about whether the person may look like they're inebriated, yeah. And so we team up with them to respond out as well.
Ms. Schuster, is there, from your perspective, and we've talked about the picking up trash idea, and also the challenge, big support of the First Amendment right here, obviously, so understand that issue. But given those parameters, is there more that the county could do to address the issue of homelessness and panhandling? And if so, what?
Answer the phones. If you're out there during an eviction to provide help to get people housed, bring the paperwork. 3 times, no paperwork. And the ones that this person talked to had applied to the programs in the past. I'm sorry, I'm getting emotional here because I've been doing this so long and I've seen so much of this going on. We're given places to call, or for them to call. I can't call for somebody.
Right.
Okay? They have to call themselves. So we have had a couple people call these organizations where they actually answer the telephone. No, we can't help you, they've got to call. They call, nobody answers the telephones. In order to get into these shelters, they have to go through coordinated entry. That's the first stop for all of this. And I've heard numerous times, like I said, nobody's answering the telephones. There's not enough shelters. The other problem we're facing with the shelters is a lot of the homeless have pets. That's their family. You know, just like my cats at home, those are my kids. My kids are both grown. So those cats are my kids. They have their dogs, they have their cats. They're not leaving them behind. So that needs to be taken into consideration also. During COVID, I know they opened up a bunch of the motels and whatnot, or the critical and whatnot. But we saw there were a lot of drugs there. There was a lot of violence in some of these places. So people would get thrown out. So then the attempt was made, well, let's put them in this one instead. Same thing happened. Whereas I've got some guy over here who really needs a place but can't get into it because we keep trying to help this one guy who really doesn't want help. He just, yeah, I got a warm bed, but I'm getting high and I'm getting drunk. We as a community need to do better with shelters, with mental health care, which I know is really difficult to do because a lot of them aren't interested. We've dealt with that out by us. But we've got to figure out a way to help these people. And like I said earlier, we had a bunch of layoffs just happen, a bunch of firings. It's going to get worse. During COVID, if you had 6 months saved up, 6 months you were done. It was gone. COVID went out, what was it, a year? Over a year?
Yeah.
We've got to do better as a community in providing better services.
Yeah, sure.
Because you did mention coordinated entry. And so what I will tell you is that for coordinated entry, we have 4 workers answering the phones, which is about 11,000 calls a month for coordinated entry. So yeah, there are some times where folks will call through that they can't get through and people get frustrated. So that is,
11,000 calls a month?
And so what we have done this fiscal year, because we recognize 2 things. One is that we need to extend our hours for coordinated entry because people get homeless on the weekend too. Okay? Just not Monday through Friday. And that we have gone to the board to ask for additional positions because we understand that when people are in crises, they need to get through. They need to talk to someone. They need to be triaged to get them to the next level. But I will tell you, and many of you have lived in this community for a very long time like I have, coming to the realization that homelessness is real, we're just getting there. We're just getting there. And so where they're in other communities, we gotta catch up. We have to catch up. Now, there are not enough spaces. There's not enough. Our shelters stay full. They stay full. We have the Falazzo Emergency Shelter. We have the supportive shelter. We have the drop-in center. Right now, we are in the midst of hypothermia season, right, which ends March 31st. And this is the coldest winter we've had in a long time. So what we've had to do, and we've done it, is that we have extended our hours and we have deployed county staff to other shelters, Manassas Baptist Hypothermia Shelter and Streetlight, to make sure that people can get in and be sheltered and not be in the cold. We are hoping that in spring that we will break ground so we can start building for our Navigation Center East. And we are still looking continuously for land for our Navigation Center West. But as much as we know that homelessness is a problem and it's real, There are some folks that do not want a homeless shelter in their neighborhood.
Yeah.
That's real. And so we are still, we're still fighting the fight because we know that it is necessary and we've got to get it done. But some of the things that you were saying and reference, it is very true and we recognize that. But we have to get everybody on board. And we need the support of not only the community, but all of our community partners as well. So I just wanted you to recognize that we do recognize that and we are trying to address that issue.
That's an incredible number of calls.
Yeah.
I'm gonna put Dr. Gantine on the spot here because I didn't prepare you for this question, but so if you don't have an answer, that's fine. But I'm just wondering, from a public policy standpoint, are you aware of other states or localities that have come up with creative solutions or different solutions or solutions that have worked?
Yeah, so prior to me being in Prince William County, I've been a resident since 2015, but from 2022 to around 2022, I was in Austin, Texas, and really great model there. They have a community partner that actually it's in a church, but so you were talking about the not having an ID and needing things like that. So with their HMS system, they actually have set up so that if you need to get mail, they collect mail for you. They will print out an ID so that if you have any paperwork that needs to get filled out, you can do it right there. They have showers. They have food. So counselors and social workers are there with their computers and their laptops, and they're registering people for services right there. And so it sounds like what our county is going to invest in with this navigation center will be something similar to that. I did want to mention that we also have the CRC, which is the Crisis Receiving Center, that will be coming on board in August. And in April, we also have the 311 system. So that will allow us to, again, to be able to pull some of this data together so that we can have a more coordinated response. So there are states and places that are creating systems that would help us, and I think the navigation center is going to be crucial to that, as well as the CRC and our 311 system.
Can you explain 311?
So 311 is a number that folks can call to sort of just what Phyllis was saying. So you see someone, what are the resources? How do we start to bring those resources where they need to be? And then it allows us to also collect data around where you're seeing these issues. So where should we be putting investments? If everyone on that site is saying, I want resources on this particular thing, then that's something that we can use to further create initiatives and policy.
We're going to open it up to the floor here. Do folks out here have questions? Right here in front.
I got a comment first, then I got a question. A couple questions. The first thing I'd like to say is it's very warming to see the hearts that you have and the sincerity and empathy you have for your fellow man.
Yeah.
I'm impressed by that. That's the first thing I see, and I saw that the other day at another charity conference I went to the other morning, where the volunteers and people involved in the charities, and in this case, government agencies. You are showing and sharing so much empathy that it's warming my heart, and I'm praising the Lord for that you have that, and that our county has put some of these things in motion, and that individuals put things in motion this way. It's very, very warming. But I do have a couple of questions. One question has to do with it. Someone said they serve 200,000 residents, and I'd like to have that explained because we only have 500,000 in Prince William County. So 200,000 residents is 40% of the county is calling for social services, and that seems like a high number. And when you say you only have 4 employees dealing with some of the stuff that we're talking about tonight, the other one was 11,000 calls per month on this issue. Are any of those calls duplicative, or is that just numerical calls in your county? A bunch of them be duplicative. Then the last thing I have is one of the reasons I came here and supported this discussion is I don't like seeing panhandlers on the median strips in the road, with or without children, is dangerous, okay? With that, you haven't mentioned anything about fraudulent people just doing it for a living. But from what you've said, all the people doing it are doing it because they need help. Okay, so if you can comment on the fraudulent people who do it because that's what they do to make a living, and they find it an easy way to make a living. And I've bumped into one person in my time that I know that does it for a living. So those are my questions. I'll stop.
You want to tackle this?
The best I can.
Okay.
So first, let me say, in reference to the 11,000 calls, I misspoke. It's not per month, it's per year.
Okay.
Okay, it's 11,000 per year, so I want to make sure that I correct that. The number of the 210,000, right, it is 40% because our population in the county is right around 500,000. Now that 210,000 represents residents of the county who apply, who receive one or more benefits like SNAP, TANF, Medicaid, refugee cash assistance. It's a high amount. It's a high amount. Now, that number, I believe, was prior to, in the midst of when we were in the pandemic. And that was before we had to go through the process of Medicaid renewal. As we have gone through the process of Medicaid renewal, because during the pandemic, you could apply one time, and then for 3 years, you did not need to reapply. Then they said, no, we're out of the pandemic. Now we have to go through the process of doing renewal. So, matter of fact, on Tuesday, the number I provided is less. It's 141,000 residents actually that receive one or more benefits, which represents about 28% of the population. Okay? And so for the third question in reference to those who are fraudulent, that's a hard one, right? Because it's self-reported. People are telling you, yeah, I'm unsheltered, or I'm doing this because I don't make enough money, or I'm work part-time and it's to supplement my income. And so I don't think we really get into whether you're fraudulent or not. I think we really get into how can we move you from this position that you're in to the next. Do you need to apply for benefits? If so, how can we help you do that? Do you need to be in a shelter? And there are times, I will tell you, when the shelters are full, there's other parts of the department that will assist. If there's someone that's elderly or they have medical issues and the shelters are full, then we pull in our adult services team. If it's a mother or father that is homeless and they have children with them and the shelters are full, then we will send that to our prevention assessment team, because our goal is to make sure that they're safe, to get them assigned with a worker to help them get through the next steps. I hope I answered the question.
Thank you.
Al?
Quick question, I believe, for Ms. Jennings. Veterans, in the past, when I spent some time working with the homeless, veterans didn't have like DD 214s or ID cards or whatever to apply for benefits, and I called on the state for help through elected officials. Rich Anderson was a big help when he was in office. Do you connect with the state very much to help veterans? Oh, and by the way, are you connected to the American Legion of VFW, who have services officers that will help with the paperwork? So just wondering how you handle veterans in the woods.
Well, I know that my staff through Homeless Services do work with veterans, and they also work with the Office of Housing and Community Development, where they have special programs to help the veterans. The CCOM, I mean not CCOM, I'm sorry, the CCO, the COC, Continuum of Care, too many acronyms, work with the veterans as well. And so we try to work together because there are some veterans in the community that are struggling. And there are some that are homeless. If they come to our attention, then we try to make sure that they are connected with the right services.
And the VFW and American Legion services officers who will actually do the paperwork, are they in the loop?
I'm not sure, I don't want to
They
say.
should be, is my point, because both of them have services officers who will help fill out the paperwork and even help file the disability. So if they're not on your list now, they should be. And I see you're writing that down, thank you.
I do know for the few that we have run into, they have gotten to the VFW, they have gotten to the American Legion, they have received help. I'm not seeing as many veterans out there as I used to in the past, because those programs have helped to get them housed. And because I'm not seeing them back, I'm assuming it's worked for them, which, thank you.
The experience I had was there was often associated mental health issue,
Right.
particularly PTSD, which made it particularly challenging. I don't know if you ran into that, but I have.
Oh, yeah, we have.
Question back here.
Thank you.
The Supreme Court has ruled on this, just like First Amendment protected activity, just like 14th Amendment birthright. The Supreme Court has ruled on both those things. Anybody that's gone after them is a fool. Let me ask the real question here: is there anything intrinsically wrong with Panhandling?
Besides the fact it's dangerous.
The constitutionally protected being your point.
So let's unpack that a little bit. You said, is there anything inherently wrong? What does that mean? Wrong, what does wrong mean? Wrong to whom? Right? So if it's protected, I guess you're asking the question, is it illegal? And it's not, right? So I think there's another layer here that is more than the legality of panhandling, right? We're talking about what is the social context of being out, right? Or sleeping outdoors, or just being homeless and requiring, income from this source, right? And that's not something I think any one person can answer in the sense to say something is wrong, right?
Well, I'm focusing on panhandling, not sleeping outdoors or anything else. Is panhandling intrinsically wrong?
I would say yes, it is, because why do we have human beings out there having to panhandle to make a living?
I think his point was it's constitutionally protected.
Yeah, it
You know,
is. So that's
whether you like it or
understood.
not.
It's nothing wrong with panhandling, right? I mean, it's a danger for them.
It is dangerous out there. We've had several hit by cars.
And, people riding bicycles the wrong way on the street too. It's dangerous. Understood?
I agree, but when they become violent, and that has happened numerous times, especially on Dale Boulevard,
And not just panhandling.
and not just panhandling. It gets aggressive, it's dangerous for them, but it's also dangerous for me. I don't want, I can hold my own. Yeah, I'm old, but I'm well trained. I can hold my own. Can tell you I've done it out there at outreach.
If you don't want danger, stay in your house and don't come out, because there's danger all over the place.
I don't even know what to say to that.
If I may, statistically, Fairfax County, and I think one of our counties to the south, and Prince William County, because I asked Kenny Bodie, the original goal of ending panhandling was supposedly public safety. No data supports that. They couldn't find the data in Prince William County to support it. Fairfax County identified four intersection accidents, none of which had to do anything with panhandling, and that was a completely false issue, which is why they moved on to, well, let's pay them to pick stuff up, and other reasons, just because panhandling offends some people.
Well, that was.
But the safety issue is a false issue. Let's look it up.
And unfortunately, the gentleman from the police department couldn't be here because that was certainly something we could have asked.
Well, it's the same math.
Yeah.
It's the county did the math for Supervisor Vega
Right.
and could not come up with a real safety issue.
Can I say something?
Yes, ma'am.
I can just imagine that panhandling.
Speak up.
I mean, yeah. If a person has money and has no way of protecting himself or herself, then he or she can be a victim of robbery. That's one instance that I could think of. A woman could be raped. At the same time, she can be a victim of robbery. And not only that, she can be killed because she has money in her pocket. I would think that's one of the reasons why we can't allow this to happen, if we can do something about it. Because we're exposing these people, just you and me, you and I can also be exposed if I'm just walking, but all the more for them, because they're not protected, they're just walking in the sidewalks or in the middle of the road with money in their pockets. Okay, but I also want to say something else. I have a friend, and her sister has a mental issue. The sister wouldn't like any help whatsoever, so she could be gallivanting, walking in the streets, right? However, the only reason she could, however, she found a way, and that is to be a court-appointed guardian. In that sense, she managed to help her get hospitalization, do all the paperwork, and at the same time give her medication. In that, when she did that, after she did that, her sister was safe again. She lives in an apartment, and I would say reasonably safe in her apartment. So what I'm trying to get at is, anybody who's out there with mental issues cannot be helped unless somebody steps in to become a court-appointed guardian. Now, most relatives wouldn't probably spend time with these people, right? So my concern is, will there be any policy that the government can think of to help them? Because I don't think anyone can help them. No medication, no paperwork, nothing. They will be left gallivanting. And all we do is try to house them. They go out, they do the same thing over and over again. However, if there is another policy in place that can really help them more aggressively, I think we have a better chance. Otherwise, these people gallivanting out there without anybody who can do the paperwork for them, who can help them get medication, I don't think
Let me
we
put the question.
can do anything better than just that.
Someone in the back on slide.
Well, on the mental health issue, is there something more that we can do?
Well, I think there's two sides to that.
So when you're talking about someone becoming a guardian, essentially what you're asking is for the court, because it has to be the court, to determine that this person is incapacitated, right? We can't make that determination. See, community services can't make that determination, because when you're saying that someone's incapacitated, whether it's physically incapacitated or mentally, you're saying they can no longer make decisions, and you're taking their rights away. And so there is a burden of evidence or proof that you would need to provide in order to do that. And it's a process. And so I do know that if someone, because I've seen it going down Cardinal Drive, when someone walking in the middle of the road, and I don't know if it was her sister, but it was somebody else walking right beside her, waiting for the police to come. And we have the co-responder team that responds out, right? She may get to the hospital, she may be there detained for 72 hours, but within 72 hours, there has to be a decision made whether he or she is going to be detained further or they're going to be released. But it is hard to determine, and the court doesn't like to say someone's incapacitated because you're taking their rights away. But that is the only way you're going to be able to get someone to be a guardian, unless that individual is willing to say, I want this person to be my guardian, and give them the executive right to make all the decisions for me.
If I may.
Back there?
Yeah, I kind of have a couple of questions. They're all kind of layered together, and you guys can answer them, I guess, as a group, because it's not for anyone in particular. It almost seems like there's a little bit of a disconnect from the programs and then regular people like me. I'm learning so much tonight. There's all these programs and places that I'm not, thank you, that I'm not privy to. So, I guess my first question, right? Well, my first question was, before I heard all of this stuff from you, was would better programs encourage these people to use them more? You mentioned there's something about picking up trash for $13 an hour. And I guess they'd rather stand on the corner versus picking up trash because they can get more money. So does that mean we need to have programs that are more enticing to them? That's my first question. And then my second question, which kind of piggybacks on that, is if we do have better programs, what does a better program look like? We know what we think would work, but to them, what would a better program look like? How can we encourage them to use those programs? And then also, how do we get people like me to find out about these programs? Like there's this 311 number and another number you mentioned. I almost hit a lady the other day, just being honest. It was right after it snowed. There was snow on the sidewalk. I was trying to turn on to Gideon. I think, what is that road? Dale Boulevard? I don't know. I'm not great with roads. But I was trying to turn on to Gideon. It was like she was in the middle of the road. I didn't want to catch a manslaughter charge. So it's like, do I just like honk and hope that someone doesn't rear end me because I've now got my kids in the car? How do we get more people like me to find out about these programs? Because they sound great, you know, and you know, I live in a community where I think most of the people, piggyback on what Al is saying, I'm sorry, I'm trying not to ramble. Yeah, it's a safety issue, but I think a lot of people find panhandlers as a nuisance. So then you have people like me who would like to not just look at them as a nuisance and really help in a way, and it sounds like there's lots of programs. So how can we spread the information about these programs to other people so that when someone does say they're a nuisance, I can do my part and say, here are some resources for us who are not homeless that we can connect with these resources to help these people, help any way we can if, you know, we're not in a position to give money or gift cards or something like that. That was a lot, I'm sorry.
It's okay. So we want to take that question?
I'd like to say something on that. I talk about hugs everywhere I go. I was in Giant several years ago. They had bug spray on sale. I had fabulous coupons. Love coupons. Back in the day when they were actually coming out. I had 18 cans of bug spray on the counter. Man in front of me looks at me and said, "Oh, you must be going camping." And I said, "No, it's for the homeless." He walked out to his car, put his stuff back in, put it in the car, came back. And at that point, I was getting ready to pay for my groceries. He tried to pay for my groceries, said, no, 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 no. He gave me $200. Every other week I'd see him, and he would give me money to buy to help the homeless. I have been in the dollar store, and somebody will see, you know, because I pick up stuff whenever I see it. You got a lot of stuff there. What's that for? For the homeless. They'll hand me a couple of bucks. I talk about hugs everywhere. I'm sure Ken does too.
But I think to address this, I think that's fantastic.
You need.
We need more. How can we have more outreach beyond just the people at this table?
We have to be talking about it.
Yeah.
Okay. We have to talk about hugs. We have to talk about coordinated entry. We need to talk about the mental health services. We need to get more information out to everybody. But in order to do that, we need to talk.
So Tahita mentioned 311, which is essentially an idea at this point, right? It's not functioning. It's not
And
functioning at this point, right? So it's something that is in creation, but it's not up and running yet, right? I think I mentioned the number that you can call, the panhandling number, the 792-3939, where you can call if you see someone panhandling, you have a concern, they're in the median, it goes to the outreach worker, they respond out. But you also mentioned another part which I think falls actually with the police, right? Because it's a safety issue. If you see somebody just walking in the middle of the road and they might cause an accident, you call 6500, the non-emergency number, or 911, and they will respond out. So everybody that's in the middle of the road is not necessarily panhandling, but you might not know that, but those are two options, okay? And I will leave this with you, right? I go to the Board of County Supervisor meetings quite often, and there's a lot of things that are discussed there. But what is not discussed is the concern regarding homelessness and the advocacy that needs to occur in reference to the services that are needed. We have services, but we need more. And what they say, the squeaky wheel gets the oil? Grease?
Yeah.
What is it?
Grease.
Okay.
Same thing.
But you know what I mean.
Yeah.
Is that as citizens in the county, it's important to be at the board meetings and show up and advocate, okay? Because the folks that we're talking about here right now are not going to show up at the board meeting because they're trying to survive. That's the mode that they're in. They're trying to survive. But for us who have the time and the advocacy, we really need to be there to say, hey, this is what I see going on. These are my concerns. What is the county doing? How can we help? What else needs to happen? Because when you talk about it again, we have a part over here that says, they're fine, they're okay, they're not bothering us, leave them alone. And then we have the other part that says, it's a nuisance, you need to do something about it. And so I think that speaks to the gentleman when he asked, is there something wrong with, panhandling? And I think that goes back to your own value judgment.
I think we have time maybe for, go ahead.
There's a hand.
Okay.
I just have one question. So Ms. Jennings, I think that you have, or correct me if I'm wrong, I think you have teams that are focused on outreach and education, and I think she was asking about awareness. How does she find out? And I think you have teams that are spread throughout this county that spread awareness about your programs. Is that accurate?
Yeah,
Leading question.
Sorry, Ms. Jennings.
That's okay. That is all right. And it's not just the teams within homeless services, but it's also the community partners. Again, we have the continuum of care. We have the Council of Ministries, the CCOM, the different churches that provides the meals to the shelters, and then the workers that are out. And so what I will tell you is that I can't remember Miss Younger, right? We were talking this afternoon and she asked me, hey, do you all ever come out and do panels, or do you ever come out and do presentations? Absolutely. We come out to the different churches, to the different organizations. So because our thing is getting from behind the walls and getting in the community and let people know what we're offering, what services are out there, and so that folks can also communicate with us and let us know what's needed. I hope that answered your question.
Yeah, it does.
Okay.
I actually, that was part of the question. Another part of the question was, if I guess it was about having better programs. I think they sound good, but what would be more enticing for these people to utilize these services? Are they aware of these programs and services? I don't know, I just feel like there's a little bit of a disconnect because these sound so helpful, But like, is it just that the people out there are not aware of them, or do they just not favor them?
Maybe
And
we
how-
could,
if they
maybe
don't
first,
favor them, how
we
can
can
we
first
get them?
correct so that we currently don't have a program for picking up trash.
Yeah, that was-
Okay, that's just.
So that doesn't exist.
It was a proposal
Yeah.
that was
Yeah,
not approved.
that has not been approved by the board.
Okay.
Yeah.
But what program, I mean, to our question, and somebody want to jump in here, what programs do people who are homeless think would work? I guess that's sort of the.
And again, and this is just me, but I think that it depends on where the person is mentally and if they're ready, right? Like I said, we encounter people sometimes 3 and 4 times until that 4th time, they're then ready to work with a social worker. They're ready to get involved in some mental health counseling. So sometimes it's the first encounter, sometimes it might be the 5th or 6th encounter. There's no specific number, it's just where they are at the time.
Maybe can I say something about? Sure. And I just want to make sure that we've been saying this, that there's no one face to folks who are out there who are panhandling, right? I mean, it's not everyone is homeless, not everyone has a drug or substance use issue, and so I think it's just broadening the way that we think about this issue. It's not just something where there's just one program or programs, right? There needs to be a tailored approach for everyone who's out there who is in want of services, right? So I think that's.
We have several out there who are chronically homeless, have been out there for one, I know, 27, 30 years. A lot of these programs with the group we deal with, they are aware of them. They've applied to some of them, and nothing has ever happened after that. So they just figure, okay, nobody cares. Why should I try again? Or then you have the mental health issues. They don't want to hear it. I'm fine, I can do this. The addiction issues that they don't comprehend. A lot of them know about the programs. I've talked about them. I'm sure all of you know Joyce Entremont. Some of you know Joyce. About yay tall, about this big. Big in the homeless community. She's been doing it had been doing it for years. She finally got burned out a couple of years ago. And she dealt with a lot of chronic homeless, a lot of addiction issues. She got whole bunches into rehab. Few of them are still good today. I can think of at least one, went 4 times, still back out on the corner drinking. They're aware, but they don't feel like they're heard. So I would like to ask, come out to my outreach one Saturday and talk to my folks. I think they'd appreciate it. I know I'd appreciate it for them, because I want everybody housed. I want everybody helped.
I think we have time for one more question. So in the back there, you've had your hand up for a while. The lady in the back, yes ma'am.
I actually work for a supervisor at Cody, who serves on the board. Personally, there's a million things I could say that I can't say at the moment. One, he very strongly believes, because it's true, panhandling is not a moral failure, right? It's a societal failure.
Can you speak up? Is that?
I was saying it's not a moral failure. It's a societal failure, and we need to come together as a community to find out how we can move these people on. And it is hard. We don't always have the resources. Very often, our police are the tip of the spear. I've been to encampments with them where they've shown tremendous empathy, but they are not the people who are dealing with this. We're putting the investments there, while our social services have 4 people answering 11,000 calls a year. Somebody else had said this earlier about talking to the board, and when we have an affordable project coming up, an affordable housing project, we will hear from people who are like, is this Section 8? I don't want this there. Is this going to bring crime? Please be there. Counter that narrative. Talk about what we need. Talk about the other side of it, because it makes a difference. Because otherwise, it seems like voting against those types of projects, voting against investments in our social services, is serving what set people up, because that's all we're hearing. So please take the, if we're getting into budget season, take a look at the county website. There's gonna be a bunch of opportunities that you can come out, speak, you can have conversations. Please join in on that. And also there is the question about where to find the resources and messaging, and there is our communications team working with social services, community safety. There's a page, it's pwcgov.org/panhandling, and it connects you to some of the resources, including hugs, gives you some information on what's behind handling, and what are some of the root causes and how we can come together and work on that.
Would you repeat her question for me?
Sorry?
Would you repeat her question, as I couldn't hear her?
Oh, she was telling us about what the county limit, sorry.
Sorry, I'm not loud.
We have one more question.
I'll also just add to what Emily said. So the Office of Community Safety is going to be rolling out a website that does have resources on it for the community, for folks related, everything from housing to food and things like that. So you should see a page from us very soon.
What? Denny, one more question. That's it.
Ms. Schuster said, excuse me, that many people won't take advantage of shelters because they don't want to leave their pets behind.
Right.
Is there a better way of addressing that?
Open up another shelter that allows pets, or the current shelters. You know, granted, some of them have huge dogs. Most of the dogs are very well behaved though. But they're not going to leave that's their family. I don't know if you all have pets. You all know what I'm talking about. Their family. They are not going, if it's 10 degrees below zero or 10 degrees, I know it doesn't usually get that cold here. They're not gonna leave that dog out there to suffer just to take themselves. They want to protect that dog, or they want to protect that cat.
These shelters government run, is that a government policy, or are we talking about private?
No, we're talking about like the Palazzo, streetlight drop-in shelter, some of the churches that open up when it's really cold out. They don't allow animals.
Some governments.
Well, the Palazzo Emergency Shelter, the Hildebarg Shelter, which are shelters that we run, we do have an animal policy, which is developed by the county, but it has to be a service animal. But they are allowed in the shelter. Now, yes. Now, as far as, I can't speak to acts and serve regarding our policy, but that is our policy for the county.
Well, I think we will end the conversation there. I'm sure you all will be happy to stick around for a few minutes and address any other issues. I want to echo what this gentleman said with the very first question, which is your passion and dedication and your human interest in addressing and solving this issue comes through powerfully. And I just thank you for all that each one of you is doing individually to help, and we wish that we could all do more as a community. So how about a round of applause for our panelists? Thank you very much. Thank you all for being here this evening, and we'll stick around for a few minutes in case anybody has more questions. Thank you.
Also, before we disappear tonight, I'd like to have your attention. I just want to say that pulling these, there is